I'd like to talk in three parts of my presentation today about the people, the resources, and the relevance of the work we do. We're now up over 420 members from 12 schools and colleges on campus, as well as 5 of our important local partners, and we're continuing to grow. Last year, we added 36 new members to the Institute, and this year we've added 35 new members. 10 of our colleagues received new K Awards in the past year. This really, I think, is a testimony both to the quality of junior faculty in IHPI as well as the quality of the mentoring that our senior faculty provide in helping to establish junior faculty for their own paths of success. Now I want to bring you up to date on some of the resources that we're marshaling within IHPI. The proposed allocation for budgetary resources, substantial proportions devoted to both seeding new research as well as programs for trainees and students, acquiring new data. An important slice is a reserve fund to have some opportunity to invest in ideas that we may not have anticipated a year ago. I also want to talk about space as a resource. We're now renovating 10,000 square feet of new space that we are looking to use for many of our trainees and graduate students to come together across disciplines. We also have acquired 2 smaller spaces. One of them is called the Collaboratory, meant for project teams to come together. And then secondly, we have the Sanctuary, where groups could do more reflective work together. A new program we have is the Impact Accelerator. This is a group that has put together a series of resources to try and equip the IHPI members with more effective skills in communicating with policymakers and stakeholders about the impact of what we're doing. Another way that the Impact Accelerator is spreading the word about our work is by developing a series of policy and issue and research briefs, the first of which was released last month in conjunction with the Value-Based Insurance Design Summit here on campus. Another important piece has been equipping our members to write more effectively for the broader news media in the form of op-ed pieces, in which we've had substantial success in recent months, I'm very pleased to say.
Studying the quality of cancer care has been an opportunity to get some information out in front of the public that perhaps people weren't as aware of. We were able to publish data and get it out in front of some media channels, and I'm also working with IHPI Impact Accelerator to try to do more of an op-ed piece on that.
Another new program that I want to highlight is the IHPI R01 Boot Camp. Mark Ilgen and Sarah Hawley agreed to serve as the faculty coaches to bring the mentees together who are working actively on their R01 grants, having started last month. And one of them is Beth Torini, and we have a clip from Beth talking about how collaboration is influencing her work through IHPI.
In newborn screening, we want to make sure we get to the children before they become symptomatic and in the worst case, die of a disease or disorder that we could have prevented. So I've worked with some of the healthcare system engineers at IHPI. Maybe we can make some changes to the way the blood's collected at the bedside. Maybe we can get the pickup at the hospital more frequent. That means we can get the specimen there earlier, and we've saved dollars and saved lives at the same time.
Next, I'd like to highlight some of the important work of our Data and Methods Hub. We've been focusing on acquiring new data resources that we can share across campus. We're on the verge of acquiring a national database from the United Health Group called Optum Insight. Another new resource that we're working on obtaining is from the Healthcare Cost Institute to gain access to insurance claims on 50 million enrollees from 4 major payers. And then finally, we're working on facilitating reuse of CMS data that many of the groups in IHPI have.
We recently received a 5-year contract from NIH, and IHPI played a significant role in us getting that contract. We were able to make our budget more competitive because we didn't have to budget for the purchase of certain data sets that IHPI is working on access to through the data core.
Our communications team has been very active over the past year, thinking about how do we brand this diverse body of research that we're producing. How do we communicate that via the web, via social media, via audio and video clips. And we'll have a new website coming out very soon, and it'll include both a public website as well as an intranet website for our members. Lastly, I'd like to just focus on the relevance of the work that we do. How are we doing in terms of our academic productivity as well as our relevance to improving healthcare and population health? We're still a very prolific group, publishing over 1,400 articles in over 600 journals, and about 10% of the articles have appeared in some of the highest impact journals in our fields, those with citation indexes over 10 that often gather substantial attention both from our colleagues as well as the news media. We've also been very successful in terms of grant funding. We have over 176 new grants totaling over $100 million. This adds to a robust portfolio already in place, over 500 awards. totaling over $500 million in active funding and about $74 million in actual spending on research. One is the CMS Innovation Grant that Skip Campbell and Mike Inglesby from the Institute received recently. Another important new grant, our Kidney Epidemiology and Cost Center, being named the Coordinating Center for the U.S. Renal Data System. The Department of Defense has awarded Mark Ilgen and colleagues in our VA Mental Health Research Group a nearly $7 million grant. And then lastly, I'd like to highlight a new project which has been central to the IHPI in the past year, which is our partnership with the State Department of Community Health. It brings together 17 faculty from 5 schools and colleges across campus and 8 departments to become the evaluator of the Healthy Michigan Plan, which is Michigan's expansion of Medicaid in the state. Another important way that our work is relevant is the connections that we're able to make both in Lansing and in Washington, D.C. Back in January, Helen Levy testified before the U.S. House Ways and Means Committee on the Affordable Care Act. In July, Jeff Kulgren and I testified before the Michigan Healthcare Cost and Quality Committee. And then lastly, I want to highlight the work of Mark Fendrick and colleagues in the Center for Value-Based Insurance Design. They played a central role in a bipartisan bill that was introduced in the House and Senate in Washington, bringing value-based insurance design into the Medicare program.
When I think about impact, I think about changing practice and policy. We participate with the Blue Cross Blue Shield funded quality improvement collaboratives, and I think are right now in a lot of different specialties improving care for patients in the state of Michigan. And I know that those efforts we're doing to improve quality are spilling out across the nation now.
So we've got a number of challenges ahead. How do we build ourselves as both a physical institute as well as a virtual institute for those of you who don't have their offices out here? And we're also continuing to be creative about how we accelerate the impact of our research. We're looking to integrate students and trainees more broadly in IHPI's research, creating more opportunities for interprofessional education, and then thinking about the future of some of our important training programs, hopefully with external foundation support, but even with our internal resources to ensure that the great training opportunities we've created are sustained into the future. I'll close with just some of the questions about how do we shape the work of IHPI going forward. First, how should we prioritize among the many opportunities that we potentially could pursue? How should we use our resources to achieve our goals? What other resources do we need beyond what we already have in place? What funding mechanisms should we be considering as we prioritize opportunities? And then very specifically, what actions should we take in the next year to achieve our purpose? And we hope you'll begin to think in very specific ways about these questions that we're posing to you around the 4 major themes of the Institute and help shape the direction of the Institute and the specific plans that we pursue going forward.